What is malignant melanoma? Where does it arise from? So in dark skinned people, there is more of melanocytes. In fairer skinned people, there is lesser melanocytes. So where exactly it occurs and why does it occur? So it can happen in the iris, in the eyes. So normally in the moles that appear on our bodies, if there are some changes, then we have to be aware of and we have to report to the physician. To look at the treatment. Treatment is multimodality. Hi, I'm Dr. Jovitamartindaniel. I'm a medical oncologist at Chennai, India. I'm here to talk a few words on melanoma. What is malignant melanoma? Where does it arise from? Okay, let's go to the basics. See, normally we have on the skin cells called as melanocytes, which are the reason why the colors differ. So in dark skinned people, there is more of melanocytes. In fairer skinned people, there is lesser melanocytes. So the cancer that arises from the melanocytes is called as a malignant melanoma. Now, normally there is a lot of moles which arise in the body throughout the life, in males as well as females. But whom does it affect more? Males or females? Actually both. Advancing in the age, that is when the risk of malignant melanoma increases. So where exactly it occurs and why does it occur? So it can happen in the iris, in the eyes, or in the acral regions, that is palms and soles, and also in the ungual regions, that is in the nail bed. So there are some risk factors to this. What are the risk factors? This is sun direct exposure. UVA light is more at risk to produce malignant melanoma. UVB produces more of squamous cell carcinoma and basal cell carcinoma. Apart from that, the saloons where sun tanning is done through sun lamps, they are also a reason why malignant melanoma can happen. Malignant melanoma can also happen in mucosal areas, apart from the non-mucosal areas, that is the skin. Now, mucosal areas like the mouth, in the vagina, in the penis, in the anal region also, that is in non-sun exposed areas also. So, what are the signs, warning signs? See, normally in the moles that appear on our bodies, if there are some changes, then we have to be aware of and we have to report to the physician. So, what are those changes? A, which is asymmetry. So, basically the normal looking mole will suddenly start appearing asymmetrical. One side bigger, smaller. Then the borders will look jagged. It might look speculated. It might look little varied compared to the normal pattern. Color. The color might look heterogeneous or variegated within the mole. If the mole is black color, it might suddenly start looking pink on the center or blue, different shades of different colors. D, the dimension, sudden increase in the size, more than 6 millimeter. E, very evolving tumor. F, looking fuzzy. G, looking gory. That is like an ugly duckling sign. It looks very bleeding, or it might look ulcerative. I, it might be itchy. So these are the signs which kind of point towards a malignant melanoma. So we have to go for a physician's opinion. So how do we prevent them? Trying to avoid sun exposure through wearing sun protective clothes and high SUV protective creams can help. And unnecessarily avoiding these sun baths and saloons where skin tannings are done can help. And also diet. Diet is very, very important. Where vitamin D fortified food should be taken. Green leafy vegetables, red fruits and vegetables like strawberries and beetroots, and orange vegetables and fruits like the oranges and pumpkins should be encouraged. And also screening. Whom do we do screening? Family history, only 10% contributes to malignant melanoma. So those people who have a family history should go ahead for screening. Those people who are fair and blonde, who have chance of developing freckles, who have a tendency to have malignant melanomas, then they should go for screening. Let's look at the treatment. Treatment is multimodality and surgery is the mainstay. Surgery being the primary, if the lesion is very, very small, it's just an in situ lesion, a 0.5 centimeter margin is enough. If it is a 1 millimeter lesion, 1 centimeter margin is required. 2 millimeter lesion, 2 centimeter margin is required. So basically, the margin is extremely important for malignant melanoma for good results. Then lymph node dissection, that is, lymph nodes can be affected into a higher percentage. So what happens is lymph node dissection when there is visible lymph nodes that are involved. And if the lymph nodes are very, very small, then we have to do a sentinel lymph node biopsy after the right dye being given. We also can give, adjuvant therapy. See, normally in yesteryears, they used to be giving interferons and interleukins, chemotherapies like dacarbazine and temozolomide was given. But now we have a lot of targeted agents like BRAF inhibitors. We have encorafenib, vemurafenib, dabrafenib. We have MEK inhibitors like trametinib, cobimetinib, and binimetinib. So these BRAF inhibitors and MEK inhibitors are used alongside of each other. Then the results are better. There are also other KIT mutations where KIT inhibitors can be used. NTRK mutations can happen where larotrectinib and entrectinib can be used. Apart from that, chemotherapy can be used for isolated lymphofusion, and radiation also can be very important, especially when brain metastasis is there. When there is less than 4 brain mets, we can always do a surgery and then followed by that consolidation whole brain radiation. If it is more than 4 lesions in the brain, then it is difficult to do surgery. Directly we have to go in for radiation. I hope the message that is given about malignant melanoma is useful. Thank you.